surgery, we're going to talk about sternoclavicular dislocation. We've got the ligament that connects the sternum to the clavicle, and you can get that dislocated either anterior or posterior. Posterior, it's going to present where you're going to have like a divot showing on the front side, or on either side, whichever side is affected, and then anterior, it's going to present with a larger bump. Posterior, you're definitely going to be way more concerned about than anterior. And thinking about anatomy, why would you be concerned about that?
Go ahead and proceed.
Which structures are you worried about that are posterior?
Jugular
Vein.
jugular vein.
Major arteries, veins, blood vessels. Yeah. So in general, posterior, you're going to send them to the hospital. They'll usually be hospitalized for about 3 days. And that's just to prevent them from doing anything dumb, really, and causing further damage. So here's some pictures. The clavicle is pushed out right there. This one's looking down, so this clavicle's gone out right there.
So what's the symptom you think would be of a SC dislocation posteriorly?
Loss function of
I mean, if it's crashing on the nerves and arteries, sure. But if it's not, what do you think the symptom is? What other structures are there?
muscles, ligaments.
Your esophagus? Yeah, so all of a sudden you've got a bone now that's compressing on it. They typically complain of a choking sensation because it's pushing on their airway. So just another way to kind of reinforce your understanding of what's going on with that dislocation.
Yeah. Okay, so you can also do spraying the ligament also, and that can be from hitting direct blow to the medial part of that clavicle, or you can get a blow causing like an anterior force on the shoulder, which can cause that clavicle to in turn pop out also. So that's an indirect way of doing it. With this, you can do an SC laxity test, and that's where you can push right on the clavicle itself, close to the joint, and you can feel whether it's moving whichever direction, superior, inferior, and then backwards too. So we talked a little bit about the management of the posterior dislocation. So they'll reduce it within the 48 hours when you send them to the hospital. And that'll be about 6 to 8 weeks for an anterior, and then 10 to 12 weeks for posterior. And the reason for that is they're just making sure that that ligament is completely stable before you send them back out to play. Why would we want to send an anesthesia physician to the hospital?
So you don't like lay down and press them?
Yeah. Yeah. Clavicular fracture. Same mechanism as just about any fracture. You can have a direct blow to it, and that's just going to cause a break in. They break down the sections of the clavicle into the medial 1/3, middle, and then distal. So the most common ones are the middle, right there. You can see on that X-ray. This is kind of known as a floating shoulder. But that's where that fracture's right here, and then you also get that fracture in the scapular neck as well. So it's presenting as, boom, that clavicle is like pushing way out or superiorly. How'd you guys handle this? You presented with it.
And you're supposed to like stabilize the arm.
Stabilize arm.
Yeah, the strap, shoulder strap.
Okay. Sling.
Sling.
strap, Yeah.
Check for back.
That happened to my friend.
Yeah, this is the Alman classification system, like what I was talking about. Group 1, middle 1/3, group 2, distal 1/3, and group 3 is the medial 1/3. And that's just the stats based on which ones are more common to fracture. So most likely you're gonna fracture that middle 1/3 of the clavicle rather than the medial or the distal. But it can still happen. So this is a little bit of a breakdown, even more of the group 1 and the fractures that go along with it, and whether or not you can get up to type 5 or grade 5, and that's where you're gonna have ligaments that are attached to that bone are also gonna be dislocated from the other attachment. So you guys can read all that, but so with the distal 1/3, talk about that, you can go down to where you have the fractures of the articular surface also, and then when you get down to the grade 5, you'll have it attached to proximal nor distally, but inferior fragments. So those ligaments completely break off. And you guys go again. So you got your AC joint and that distal portion of the clavicle right there, and that the coronoid ligament and the trapezoid ligament are all kind of torn off right there. And then type 2A, completely broken off. And type 2B, that's where the coronoid ligament right there is completely torn off, along with the fractures completely displaced as well, and so on. So you can just go back and forth between those two slides. So this is just what they're going to present to you as, hey, they got hit, or they fell on it, you can fall on the shoulder. And that's just gonna cause that bony deformity and the break in the clavicle. And if it's not that notable of a deformity, you can also feel for it, and you'll feel crepitus, and that's kind of that grindy stuff that we talked about before. And also, I don't know if you guys have heard of like the piano key sign test, but sometimes when you think that they have an AC joint sprain or whatnot, you can tap on it and you can see whether that clavicle will spring up or not, and then sometimes you'll be able to feel crepitus with that as well to rule out a fracture. So management, you want to rule out the first rib fractures. May require the second x-ray to confirm your diagnosis or the doctor's diagnosis. And once you get going, once that is diagnosed as a clavicular fracture, you'll start the range of motion in the glenohumeral joint and strengthening. And it usually takes about 6 weeks to get back. for the majority of the time. And you just want to make sure that you're not really going, when you start doing your range of motion, you start off early with just limited, very limited range of motion to prevent that displacement of the fracture. Okay, fun stuff. AC joint sprain. So you got your acromioclavicular ligament, attaches your acromion process to the clavicle. And this way, in this one, you can see that's where the sprain is. But you can have, there's 5 different grades of these two.